Today's National Fentanyl Awareness Day, and we now continue our morning-long discussion on the ongoing fentanyl crisis happening here in our central San Joaquin Valley.
Right now, we have Michael Prichard joining us. Michael is a substance use disorder prevention specialist from Fresno County's Department of Behavioral Health. Good morning, Michael. Thank you for being with us.
Thank you so much for having me.
This is an important topic. Can you tell us about what you do at the department and how you came to be there?
Oh, that's a good question. So I oversee all the prevention contracts for Fresno County, but I've also worked for behavioral health. I've also worked in substance use disorder contracts. I've worked as a program auditor. I'm a certified drug and alcohol counselor, and I've been in the field for about 12 years. And I teach part-time for Fresno State and CRIM on the topic of substance use. So it's pretty much all I've ever done. And I'm a person in long-term recovery too for 16 years.
Yeah, your story that brought you here is pretty remarkable, Michael.
Yeah, it's been a long road to get here, but I understand drug addiction very well, and this in particular substance was my drug of choice, not fentanyl, but opioids itself, which fentanyl is in that class of drugs. So.
Okay, can you tell us how behavioral health is helping fight this?
Yeah, we fight it on a lot of different fronts. So we do a lot of public messaging around this topic, around substance use in general. And the dangers of fentanyl since it's been happening. And we do a lot of community education as well. But we also do a lot of prevention work. In Fresno County, we typically focus on youth 10 to 20 because that's where most substance use disorders start in adolescence.
10 years old?
Yeah, so it doesn't, some as young as 10. In fact, it's I think the American Academy of Pediatrics has recommended doctors screening kids for substance beginning at 9.
Oh my!
It used to be 11, but it's because they have older siblings and people in their house that may be using and they may be exposed, and so it's a good opportunity during that screening process for doctors to actually have conversations with kids and the dangers about this early on.
Okay.
Has the pandemic had any effect on issues like this with drugs, fentanyl in particular?
Oh yeah, yeah. So substances of abuse change the way that we feel, and that's generally why people use them. People use them because they're trying to increase an already positive feeling they're having, even if their life is good. People, drink alcohol and use substances, but during times like this with the pandemic and people are going through a lot of negative emotional states and their emotions are compromised, and we've lost a lot of people in the pandemic and job loss. People were looking for some sort of comfort, and so it really drove, all substances of abuse went through the roof during the pandemic, and it resulted in a huge elevation of overdoses just from 2019 to 2020 in Fresno County.
Wow.
It increased 55%.
Oh my goodness.
In 1 year.
And how can people get help or know they need help?
Yeah, there's a variety of ways to get help depending on if what kind of insurance you have, or if you have Medi-Cal or you don't have insurance at all. So in the public system, we concentrate typically on Medi-Cal recipients, which is about half of our county, and people that don't have insurance can also access public services. So we have a 1-800 number, 1-800-645-3937, and anybody can call that access line, and they can get a screening for mental health or substance use and get a referral that way. They can also go to recoverfresno.com, and if they just scroll down the page a little bit, they'll see a provider directory, and it gives a description of all of our contracted providers. We have dozens of contracted providers providing all different kinds of levels of care for substance use, and they can walk right in and get to any of those addresses and get a screening that way. They can also go to the Urgent Care Wellness Center or the Youth Wellness Center through DBH and walk in and get a screening that way. So we kind of have a no wrong door policy in terms of helping people get the assistance they need. And our access line is really underutilized. It's underutilized.
Wow. But as you well know, you can live for a long time thinking you've got it under control.
Oh yeah, yeah. And there's a lot of shame with it too, It's like a lot of people think, well, eventually I'll get a handle on this. Mm-hmm. Well, it doesn't generally work that way because addiction is a chronic relapsing brain disease, and it's progressive. It's progressive and potentially fatal if left untreated, particularly with opioids, I would say. We lose most people in Fresno County to overdose to methamphetamine and to opioids.
You just said something I think is important. You called it a brain disease.
It is.
A lot of other people will put choice. That was your choice and that's your deal and you just deal with it yourself.
Yeah, so I think part of the problem with looking at it, once addiction develops, it's caused changes in the brain that's resulted in compulsive drug-seeking behavior that is really kind of beyond the control of the person to be able to consistently abstain from the drug. That's one of the symptoms, right? So once somebody's addicted, choice is kind of gone. Were there some choices that led up to that? Yeah, but most of that starts in teenage years, and what we're finding out, I mean, and do we trust our teenagers to be forward thinkers?
Good point,
I mean,
yeah.
you know, they're not kids, they're not adults, they're kidults, you know, and so we you know, have to monitor them, but our teenagers are under a lot of pressure, and there's a lot of kids out there that have experienced, you know, adverse childhood experiences and different kinds of events in their life that kind of put them in a negative emotional state, and then with the amount of drugs that kids have access to, including alcohol, marijuana, and, you know, prescription drugs and fentanyl, which is kind of what we focus on in prevention in Fresno County, you know, it's really easy for them to get their hands on those drugs. And so when most people that use drugs never become addicted, it doesn't mean that they're going to be, it's not going to cause problems in their life, but they never become addicted. But the percentage that do, it really has a devastating effect on their life into adulthood, you know, assuming that we don't get it arrested in their teenage years.
Oh, wow. All right.
Yeah, so it's really, addiction has been described as a pediatric developmental disease.
Wow. All right. Michael, thank you very
Yeah,
much for your
you're
perspective
welcome.
and all this information. We really appreciate it. And of course, bringing about so much awareness. If you know someone who needs help, whether it's for mental health services or substance use disorder services or anything else, please call the number on your screen here. It's 1-800-654-3937. Again, 654-3937. And we want you to know that there are real, live people who will pick up the phone and talk right now.